What I thought maybe we would spend the first just couple of minutes talking about is like what you guys have heard about e-cigarettes, questions you have, or like things that you've experienced either yourself or from maybe patients or clients that you work with. And then hopefully we'll be able to cover all of them and I may not have the answers because a lot of the research is new and evolving. And yeah, so I thought we would just start from there, and I'll just jot down people's comments or questions, and then we'll go through the presentation and we'll see if we're able to cover most of it. Yeah?
My son was never a smoker.
Mm-hmm.
And bubblegum vaping, all of these wonderful flavors and smells. So he started vaping before he smoked. In the high school, my son was the vape dealer, and he got opened his locker with 40 bottles of the vape liquid that he would sell. He would fill someone's e-cigarette for $5. He had an ongoing business.
Okay.
So he had discussed the type of base that's in there when you inhale, and there's the two basic kinds.
Yeah.
And I just cannot believe that that isn't destroying their lungs. So my biggest thing is that people, the path they're taking is to go vape first.
And then kind of graduating to traditional cigarette.
It's cool.
Could I call that? So I wrote initiation in youth and like gateway to cigarettes.
Absolutely.
Is that kind of capture?
All the kids do.
Okay, so we'll cover that.
Being a high school teacher, so I've worked in a high school for 12 years, and when I first started, we had a smoke pit outside, right?
Yeah.
That's what you did. You went to the smoke pit, and that's
Yeah.
where all the smoking happened. And I really, truly feel like we hit this moment where, the smoke pit was down to 2 or 3 people, from
Totally.
12 years ago, and now we've
Like it's gone way back up, hey?
Like the amount of kids who don't think it's actually smoking.
Totally.
Is a mind blow to me, and
Yeah.
it is. It's become a business, and
Yeah.
the social impact of that for me is really disturbing.
Yeah.
That kids are making $5 a hit, like you're meeting in the bathrooms, and there's no evidence. I mean, some teachers have the ability to smell it. For some reason, I can't. But, it's to me that's my piece.
Okay. To capture that, it sounds like
It's
kind of like
social impact and-
like renormalization,
Yeah.
or like the fact that so much work has gone into to
sensation things,
yeah, like all these public health measures have gone into decreasing cigarette smoking, and is this kind of undoing it? Does that kind of capture
and
it?
for me, I'm here to put some actual evidence into my toolkit, some actual facts that I can, when I'm talking to kids about, they just spent $240 on a new vape that a kid bought online for $40 and just made $300.
I didn't know there was all this kind of underground market for. Okay,
it's
interesting.
It's a lot like oral sex is a sex.
Okay.
Vaping isn't smoking.
Okay. Or underground market. And maybe one of the messages in that is like perceived safety. So perceived.
They think they have all this evidence for some reason that they can go online and prove to you that things don't actually exist. Like popcorn lung, I still don't know if that's a true thing or not.
We'll talk about that. Okay, we'll talk about. So perceived safety, and then kind of what are the risks? Query popcorn lung.
I hate it when they say, well, Mom, they say that. Well, who's they? I saw that
Right.
in there.
Now, can any age buy the serum without the nicotine?
You bet. So we'll talk about regulatory status, and essentially the bottom line is it's a wild west of lack of regulation right now. In BC, you're supposed to be 18 and over, but it sounds like easy to buy at the high school and also easy to buy online. And I'll tell you a little bit in the presentation about kind of where we're at in terms of regulation and where things are heading But essentially the bottom line is it's unregulated right now. So you're not supposed to be able to buy any e-cigarettes at all or e-cigarettes with nicotine in them specifically. But we know that that's easily accessible, at least if you're over 18. But technically it's illegal right now in Canada.
To purchase any of it?
Yeah.
Okay, that's gonna be my question with the.
Yeah, so it's changing to being, Health Canada has said that they're going to start regulating it, but currently it's unregulated products. And it's technically illegal to buy an e-cigarette with nicotine in it.
You mean anybody could buy one?
Well,
Oh, any-
Over 18 right now, but each province has been tasked with kind of setting up their own rules. And it's been quite slow to come out. That's why
But you know they still do it?
and that's why there's vape shops. I don't know what the scene is here, but in Vancouver, it's like every other block is a cannabis dispensary or a vape shop. Like it's just everywhere. And then like there's all these signs of like safe in pregnancy, super healthy, and we don't know. Any other questions that people had?
The safety piece from the original, remember where they were exploding, and then I talked to somebody who had one and they said, you have to soak this for so many days, and you have to do all these steps before you can use it, and I was like, that's too much work for me.
Totally.
You know?
Yeah, and we know kids are altering them, they're
Mm-hmm.
changing them so that they burn hotter, and those are the ones that are exploding, I think, but I'm not really sure.
And there's some that you can infuse with pot.
Yeah, we've heard. I don't touch that in this presentation at all, but I know I've heard that as well, that you can vape cannabis and other things. And I suspect it's probably pretty easy at the dispensary to buy cartridges to put in e-cigarettes, but I don't know for sure. Any other questions that you guys? Yeah.
I'm just wondering about the health risks for the base material, the propylene or whatever.
Propylene
whatever
glycol.
The glycol,
Yeah.
whatever that is. And I know you've got risks there, but I'm really wondering if there's any information on the health. We know smoking cigarettes and you know, and any carcinogen is not good for your lungs. I'm just wondering what this looks like.
And
Okay.
there's 2 propylene glycol and there's another one.
And there's a glycerin-based one.
Yeah.
Yeah.
And also the secondhand vape, if there's any issues with.
You guys have lots of good questions, and I don't have the answers to all of these. But I'll tell you what I do have answers for. But this isn't, I just reviewed the literature a couple of weeks ago, but I don't answer all of these questions. So there'll remain some unknowns. Second hand exposure. Any other questions that you guys have? Sorry for my messy writing.
We were just commenting on how well you were doing.
Oh,
You're not erasing it.
it's kind of legible. Anything else? One of the questions that I had, because I have lots of my patients ask me, is just about, does it work for smoking cessation? So if you're a current smoker, is this an effective, like, is this better than nicotine replacement with a patch? Or we have some oral medications that we use to help people quit smoking, and is this a good option? So I review that in this presentation because I thought clinically for me it was important. Any other questions that you guys have? Okay, yeah,
Can
sir.
you talk about the development, like how this came to be such a, just socially, and how it was developed, and sort of the marketing and that aspect?
I talk a little bit about it, about like the person that made it and kind of the evolution of what kind of the initial e-cigarettes look like and how different they look now, and a bit about the kind of industry, like how much money is going into this, which is huge. So this can be really informal. So if you have questions throughout, I will try to answer them. But it's tough to keep up to date on the literature, and this isn't my area of expertise per se. Let's see here. I don't have any ties to e-cigarette companies. I'm just going to move that. And then I have a couple of slides that are from an addiction medicine fellow in Vancouver. So I have a couple of slides from his presentation that he did. So I just found a couple of headlines, and to me it just spoke to kind of the confusion around these products. So you may have heard that in the UK, they've really supported e-cigarette use quite a bit as a harm reduction tool, and they've really advocated for their use. In the US, it's been kind of the opposite experience. And I think for most people, that's resulted in some confusion as to what to think of these products. So as I said, England's been really quite behind these products. And mixed messaging is right now really common, and physicians don't really know what to tell people. So you're not alone, or at least I didn't feel alone in feeling kind of confused. So the things that we're going to talk about is first just like an overview of what an e-cigarette is, and how, like when they were developed, et cetera. And then the kind of clinical questions that I had were, first, are e-cigarettes effective to help people quit smoking? And then, are e-cigarettes a good idea as a harm reduction tool? So we know that people will use e-cigarettes for a number of different reasons. Some people are going to use them to try and quit smoking. Some people are going to use them as a safer way to continue to smoke. And then public health concerns. And I think a lot of the questions that you guys have raised are really around the public health concerns. So in particular, looking at youth. And does that initiation in youth mean that they'll then graduate on to smoke traditional cigarettes? And what are the potential risks of these products? And really, they're really new and we don't know. So at the end, I talk about a lot of the limitations that we have in the available research. So e-cigarettes were invented by this gentleman who is a Chinese pharmacist in 2003, although I've read conflicting data, whether it was the year 2000 or 2003, early 2000s. And his father died of lung cancer related to smoking, and he himself was a smoker. And so he invented this product. Essentially what an e-cigarette is it's a battery-operated device that contains a liquid, and the liquid generally contains either propylene glycol or a vegetable glycerin, a flavoring agent usually, and then usually nicotine, although you can get nicotine-free cartridges. And essentially there's a heating element, and what the heating element does is it heats up the liquid and produces an aerosol, and then you inhale the aerosol. So that's kind of the basic structure of an e-cigarette. And you can see that there's a huge variety in terms of what these products look like. So if you look at the ones kind of furthest on the left, those are kind of the first generation products. So sometimes you'll hear them described as cigalikes because they look much more like traditional cigarettes. So when e-cigarettes first came out, this is what most of them looked like. A lot of them would look like real cigarettes, and then they'd have a heating or a little light at the end that would turn on, so it kind of looked like the burning of a cigarette. And then you can see in the last little while, these second generation products have come out. And just to go back, for the first generation products, they were generally disposable. So you would buy one when the battery died, you'd throw it out and get another one. And they were a lot cheaper. The newer products generally have a rechargeable battery, and then you buy the liquid cartridges and replace them. And so put different e-juice or e-liquid in. Some of the newer products also have adjustable heating elements. So adjustable coil, so you can turn up or down the voltage. And as you turn up the voltage, generally more nicotine is released if you have nicotine cartridges. What is challenging is because there's so much diversity in these products, it makes it really difficult to generalize the results of any study, because it's tough to compare these first generation products with one of these products. And so a lot of the research that we have, it's really tough to know whether it was done on this type of product or this type of product, and whether the results are generalizable. In terms of cost, there's a really big range. So there's ones that are kind of the first generation products in and around $10, whereas the newer, these like tank style big e-cigarettes can be $200 or more. Per e-liquid, and some people in the room may actually know this information better than I do, from the high school black market. But from what I was able to gather in Canada, it's generally about $10 to $25 for a 15 milliliter. Does that sound right?
Yep.
Okay.
Online, it's gonna be 10.
Okay.
In the local vape stores, it's
It'll be a bit more. And from what I've been able to gather, 15 milliliters in terms of how much nicotine is in it and how long you would use it is roughly equivalent to about a carton of cigarettes, so 10 packs of cigarettes. And so if you think of cost, it's actually probably quite a bit cheaper than packages of cigarettes. So that's what I've been able to gather, but again, this is me kind of looking all over to get this information. I need to ask more of my patients how long that lasts them, but that's what I've been able to gather. So you'll hear this term vaping, and that's just the process of using an e-cigarette. In terms of kind of where this is going from an economic standpoint, there's huge money in this. So it's estimated that by the end of this year, there'll be $10 billion in sales worldwide. And on the market, this is old data, so as of 2014, there were 7,500 different types of e-liquids or e-juices, and 460 different e-cigarette brands. So lots of money going into this. I think almost all of the makers of like major tobacco companies now have an e-cigarette. So a lot of the cigarette companies are recognizing that this is a new kind of market opportunity for them. The other concerning thing is a lot of the research on these products is coming from tobacco companies, is funded by tobacco companies. And so you have to, like from a scientific standpoint, really take that with a grain of salt when you're reading it, because they have a lot of interest in having these products be successful. Is that kind of shaking? Am I doing that? Okay. Okay, just ignore that. It's not an earthquake. So it's expected that by 2024, electronic cigarette consumption will surpass that of traditional cigarette consumption worldwide. So this is the most recent Canadian data that I could find, and it's kind of old already, and I suspect the numbers are higher. So as of 2015, I thought the numbers would be higher as of 2015, but 13% had reported ever trying an e-cigarette, and only about 1% reported daily use. When we look at the numbers among youth, those aged 15 to 19, 25% reported ever trying an e-cigarette, and among those aged 20 to 24, about 30% had tried it. I think the numbers are higher now. What would you guys estimate?
Always surprising, because when we look at all of the health surveys on our youth in BC, the numbers are always surprising. Like when you look at the number of kids who have tried marijuana,
Yeah.
it's always the hype in a building that kids, the way they talk like they've all done it, but really at the end of the day, put them in a room with a piece of paper that says, have you done it, they're gonna, you know,
So it's fair to get,
the hype
it's,
is huge.
yeah,
I'm not sure they're all doing it.
Okay.
Which is what is the impression we have. Right?
Okay.
They all say.
Yeah, and
They all
it's the
say
same
they're
with
doing
sex among youth too. We know
Yeah,
that they're
totally.
not all doing it, but yet they're all
People are
talking the
talking
talk,
about it.
right? So
You bet.
I don't know what those numbers are.
yeah, I couldn't find how many youth or young adults were regular users either, so this is having tried it. And I would expect that the numbers for having tried conventional cigarettes ever would be around the same for that like a quarter of people had aged 15 to 19 had tried a cigarette before. So I was actually expecting it to be higher than this, but
I would say 2 or 3 years ago, the hype in high school around vaping was the tricks you did with it.
like the blowing.
Yeah, that was all the YouTube glory, right? So even 2, 3 years ago, that's what they were doing with it, was their tricks, right?
Right.
So you call a kid out on vaping, it's like, you're gonna look so cool, watch, right?
Yeah.
But the tone around it has shifted away from that in the last 2, 3 years.
Okay. Oh, that's interesting to hear. I'm glad that you're here and providing that perspective because it's not I don't see youth in my regular clinic, so I don't have that perspective, so that's really great. Among people who smoke cigarettes, about 50%, and again, this is in 2015, I'd expect that in the last year it's probably gone up. 50% have used an e-cigarette compared to less than 10% of non-smokers, and 22% reported using an e-cigarette to help them quit smoking in the past 2 years, and 35%, oh, that's really hard to look at, wiggling, reported using an e-cigarette when they were unable to smoke cigarettes, for example, in locations like smoking inside, etc. Or they were using it to smoke fewer cigarettes, so using it kind of as a harm reduction tool.
How do they really know how much nicotine they're getting though? Because it's so hard to gauge. If somebody is a smoker of cigarettes, then they say, okay, I smoke 10 a day or 20, and because
Yeah.
you have a certain number in a pack, but with an e-smoke, you're filling it. Can you even see the amount that the liquid goes down per day?
But you also buy
Y-
percentages.
You can buy percentages, like higher nicotine percentages. So I expect people with a high nicotine tolerance, if they're using it to help them quit, will start with a higher percentage. From the literature that I've been able to find, the amount of nicotine that you get from smoking an e-cigarette is less than that of a conventional cigarette. But I don't know exactly what percentage, and there's so many variables, like it depends on your device, the heating element, so the hotter the heating element, the more nicotine you're gonna get. And then, yeah, exactly. So like, are you smoking for 5 minutes, or are you smoking for 30 minutes? So
Are you at
we don't know.
5% or 12%?
Exactly.
All the different percentages there.
You bet. So there's a lot of variables that the research really hasn't controlled for all these different things. And because the products are unregulated right now, we really don't know. So it's not like nicotine replacement, where with a nicotine patch, I can say like, okay, if you smoke a pack per day, you likely need a 21 milligram patch. If you smoke half a pack per day, we could probably start you with a 14 milligram patch. With this, I'm like, I don't know. I guess keep trying it if this is what you really want to do. So currently, it's not legal to sell nicotine e-cigarettes in Canada, or to sell nicotine like cartridges for e-cigarettes. But we know that it's being done, and there's businesses that's the whole point of their business. But currently, that it's technically illegal in Canada. They're really unregulated, so each province has been tasked thus far with developing legislation around rules such as age of purchase, and kind of if you're able to smoke them inside versus outside, if you have to be 9 meters away from a door, if you can use them in restaurants, all those types of things. In BC, the rules are similar to what they are for tobacco cigarettes, but I'm not sure that they're enforced as much as they would be if someone lit a cigarette in a nightclub. So I think if someone uses their e-cigarette in a nightclub or in a restaurant, people may or may not ask you to stop. Health Canada did announce in November of 2016 that they're planning on making amendments to the Tobacco Act and to make it kind of official around regulations on manufacturing, sales, labeling, and promotion of e-cigarettes. But that hasn't happened yet. So we will see how soon that happens. So right now it's this big kind of Wild West unregulated gray zone. So are e-cigarettes effective for smoking cessation? There's really been two big, what are called, it's pretty good, hey? There's been two big, what are called systematic reviews and meta-analyses. What that means, what a systematic review and meta-analysis is they take multiple studies and pool all the results, and then it gives you a better picture, especially when you have multiple kind of smaller studies. So if you have like 100 people in this study and 200 people and 25 people in this study, what they do is they pool all that and they review all the studies and then come out with like an overall summary. So in medicine, this is something that we use quite commonly because it gives us kind of a better idea of what's going on rather than just one study a lot of the time. So I found there's two kind of big systematic reviews and meta-analyses that look at slightly different things. So this study was released just several months ago, so in February 2017, and it looked at electronic nicotine delivery systems, so e-cigarettes with nicotine versus e-cigarettes without nicotine, essentially. So that's what they were looking at, and they were looking at smoking cessation or a reduction in smoking. So they aimed to investigate the impact of ENDS's electronic nicotine delivery system, so e-cigarettes with nicotine, versus the same devices but without nicotine in cigarette smokers. And they wanted to see whether it resulted in people quitting smoking or reducing their tobacco cessation. They included 3 RCT, stands for randomized control trials. So that means that people were enrolled in the study were randomly allocated to receive either an e-cigarette with nicotine or one without nicotine. And they also included 9 what are called cohort studies. So these are people that are using the product or not. They may have a control group, so people not using the product. And they're not necessarily told you have to go on this, or they're just following people who are already using e-cigarettes and then following them forward and seeing what happens to them. You can see the number, so the number of people in all 3 of the RCTs is pretty small. So even with 3 studies, it's only 1,000 people. In the cohort studies, when they pooled them, it's 13,000 people, so a bit bigger. What they found is when they looked at just the randomized clinical trials, what it showed was a possible increase in smoking cessation with the electronic devices compared to the e-cigarette products without nicotine. So that's pretty encouraging that this may be a positive thing to help people quit smoking. But then the findings from the cohort study actually suggested the opposite. So what they found was people were actually less likely to quit using e-cigarettes that had nicotine compared to the e-cigarettes without nicotine. So there are quite different results depending on the RCTs compared to the cohort studies. So that was kind of surprising. This next study, I think captures what's realistic of the everyday person using an e-cigarette. So they looked at a slightly different population. So this was published in The Lancet in February 2016. And they wanted to look at the association between e-cigarette use and cigarette smoking cessation, so quitting smoking, among all adult cigarette smokers, including smokers who wanted to quit, as well as those who didn't want to quit. And I like that design because I think that we or we know that there's people that use e-cigarettes for different reasons. So there's some people who are using them because they want to quit smoking combustible cigarettes. And then there's other people who want to use them maybe as a harm reduction tool, maybe to help them decrease their conventional cigarette use, but don't necessarily want to quit smoking. And to me, this kind of asks the question as to whether if you're using an e-cigarette, will you get enough nicotine so that maybe your conventional cigarette use just peters out? So any questions about that study design or that population? I liked it. At first I was like, why would they include people that didn't want to quit? But I think this is very realistic of kind of the everyday population. And they found that, again, there was a discrepancy between the findings between the randomized clinical trials and the cohort studies. So there's something about the design of being in a clinical trial that doesn't seem that representative of what's happening in the real world. Their endpoint that they were looking at was smoking cessation, so quitting smoking. And they had 38 studies included. And what they found was really interesting. So they found that the odds of quitting were 28% lower in those who used e-cigarettes compared to those who did not use e-cigarettes. So again, this finding is suggestive that using an e-cigarette makes you less likely to quit smoking.
Does that include people who use NRT, like those who didn't use the e-cigarettes? Does this-
You know what, that's a good question, but I don't know that all the control groups necessarily used NRT. It's a good question that I think it would depend at looking at the individual studies, but I don't think that was a necessity for the studies that the control group was on and either NRT with a patch or Champex or something else. From the e-cigarette studies that I've looked at, some have had a NRT control group, and some have had just an e-cigarette with nothing in it as like a placebo. So I don't think that they were all given NRT. But I think that's the direction that I would like to see the research go, is that compared to the products that we do have do these work. Yeah.
So then, the odds of quitting is 28% lower, and did they separate out those who wanted to and those who didn't want to, just so you can separate the data?
Yeah, so that was this
That's
next point. So the results didn't differ significantly when they looked at those studies that enrolled people who were using an e-cigarette with the intention to quit and those who were just using them. So regardless of intention, using an e-cigarette seemed to make it less likely that you would actually quit smoking.
And what by definition, use of e-cigarette was like that it replaced, or it was augmented, or it was in conjunction? Like what was that defined at all?
Say that again?
Well, just the use of the e-cigarette, is that relating to quitting smoking?
Mm-hmm.
Did it clarify if it was augmenting cigarette smoking or replacing it or any of that, or just?
I think people were just given the product. Again, depends on the study. The RCTs, they've been given the product and said kind of use it as much as you want. And then if they're smoking on top, then they count as not quitting. Most cigarette trials, they do carbon monoxide levels to document whether someone's successful. Like they'll ask them on history, but then they also want to see a carbon monoxide level that's usually less than 9 parts per million as kind of documentation that they likely have quit smoking. Does that?
Yeah, so then there weren't, like, unlike nicotine replacement therapy studies that are pretty specific about what you're using and strategies and lozenges or whatever, this wasn't really tailored to like see if this system works. It was more just to the e-cigarettes. What are their impacts potentially?
Yeah, I think so, and I think it's a bit tricky because it's so many different studies.
Well, that too, yeah.
That they, like the RCTs, they're given one e-cigarette, so all the e-cigarettes are the same product. It's not like buy your own e-cigarette and then buy your own nicotine cartridge. They give one product, but for the cohort studies, I expect they're not given, they just buy an e-cigarette and are using whatever e-cigarette they have.
But they're not given instructions on how to use it
No.
or what to try to do? Or
No, exactly. I think that most smoking cessation trials are also given counseling in both groups. So I expect in both groups I haven't read all 38 studies. I've just read the review. But usually in smoking cessation trials, they're given whatever the drug is or the placebo, and then they're also given counseling. So I expect in all the groups they're probably given that as well. But I can't say for sure because I haven't read all the studies.
What are the odds in nicotine tensions?
Good question. So the odds are that you're much more likely to quit if you're on nicotine replacement. When we look at the three kind of first line pharmacotherapies that we have for smoking cessation, our medication called varenicline, the brand name for it is Champex, and that about 3 in every 10 people are successful with Champex. Combination nicotine replacement is kind of second best, and it's pretty close to Champex. So what I mean by combination nicotine replacement is using a patch plus a form of short acting, so like a patch plus an inhaler, patch plus a gum. And the odds are similar, about 3 in every 10 people are successful using combination NRT. We look at nicotine replacement like monotherapy, so just a patch, just gum, just a lozenge. Patch is the best NRT formulation compared to the short-acting forms, and it's about 2 in every 10 people will be successful in quitting. And then the shorter acting forms, so just using the gum or just using the lozenge, are a little bit less than that. Bupropion, which is branded for smoking cessation as Zyban, is similar to the nicotine patch. So it's about 2 in every 10 people are successful.
So there wouldn't even be one instance where the e-cigarettes, it would actually be the reverse.
This is showing the reverse, that it doesn't help, that people are less likely to quit. And then when we think of people quitting cold turkey, about 5% of people are successful with a quit attempt cold turkey. So generally we would always suggest pharmacotherapy, so using a medication option, whether it's nicotine replacement or Champex or Zyban, as opposed to quitting cold turkey. In addition to kind of the psychosocial support, so that you can get like a quit coach that'll text you or call you, and or visiting with a family doc, et cetera, just to help with kind of all the other factors that contribute to smoking as a regular routine and part of your life. But what this data is showing is that you're less likely to quit overall, whereas using all the other products, you're more likely to quit, and it increases your chances of quitting.
I'm thinking about the NRT, just the inhaler.
Yeah.
Nicotine inhaler.
Yeah.
And I'm really having a hard time thinking, why on earth would somebody go out and buy one of these and go through all that work when they could take an inhaler, pop in a nicotine cartridge, and use the thing for however long they last?
Yeah.
Like, I just don't get it, even the cost.
I think that, well, yeah, the cost is free if you get it through 811, or not. You don't even have to do 811 anymore.
Right.
I think for a lot of people who have used these products, what they really like is that it gives them a bigger nicotine hit than you get with a nicotine inhaler. I know some of my patients, in the States, they have an oral spray and a nasal spray, and I forget which one we have in Canada. We only have one of them. And I've been told that gives people more of a instant nicotine hit, and so it seems to relieve cravings better. We have the spray, no, oral spray, not nasal.
Sublingual, yeah.
Okay, sublingual spray. So I think that gives people a bit of a bigger nicotine hit, and I've been told with the e-cigarettes, that's what people like, is that it gives you more of that kind of nicotine hit feeling. And then it's also the process of smoking something that I think people like. They like inhaling something and that whole process. Sorry, go ahead. Yeah, you bet. It's like that hand-mouth feeling and really inhaling, whereas with the inhaler, I think a lot of people are like, hate this thing. And it doesn't look as cool. Like when you see people smoking e-cigarettes and you see all the flavors and all this, you're like, oh, that looks kind of, like I can see why youth like it. So I think there's lots of reasons, but what this, I really like their conclusion. What they said was e-cigarettes are associated with significantly less quitting among smokers, and according to this study, e-cigarettes should not be recommended as an effective smoking cessation device. I think this is really interesting because if you think of nicotine replacement, we know nicotine replacement works well for smoking cessation, and I would think this would be similar, but the results don't seem to demonstrate that. So this will change my practice, I think. What about evidence in terms of kind of a harm reduction tool? So I just kind of summarized tidbits from a bunch of different papers. So emissions from e-cigarettes contain at least 100 times lower nitrosamines and nitrates than tobacco smoke. In the UK, their public health authorities have said that e-cigarette use is 95% less toxic than conventional cigarette use. The early studies that we do have show that in terms of cardiovascular risk, e-cigarettes seem to be much safer than cigarette use. So all of this seems encouraging. And there are some subtle acute changes in lung function with e-cigarette use, but it seems to be much less than what we see with conventional cigarettes. The caveat to this is that many people who use e-cigarettes are what are called dual smokers, so they continue to smoke conventional cigarettes. And this was a study published just a couple months ago that looked at long-term e-cigarette use and nicotine replacement therapy. And they defined long-term as being 6 months, which is pretty short-term. But because these products are so new, this is what we have in terms of the data available. So what they found is e-cigarettes are likely to be beneficial only if complete cessation of combustible cigarette smoking is achieved, and then concurrent use of e-cigarettes and combustible cigarettes did not offer a benefit in terms of toxin exposures. In terms of toxin exposures, they found no significant difference between e-cigarettes instead of NRT alone, which is, I think, kind of interesting. And then there were substantially lower levels of selected carcinogens and toxins found in those using NRT patches or e-cigarettes compared to ongoing smokers. Full cessation, their kind of bottom line was full cessation of all nicotine products remains the best option to avoid harm. So not chronic use forever. So if you have someone we should be encouraging them probably to, if they are going to use an e-cigarette, to switch totally to an e-cigarette and not use any conventional cigarettes, but then also talking to them about selecting a quit date for their e-cigarette use or tapering down, not to use it indefinitely. And this study, one of the limitations is they looked at a specific number of toxins, and there's a lot of other studies that have shown concerns about a much longer list of potential toxins. And it's really hard with 7,500 different e-liquids and all these different products and brands to know what are the effects of all of this. We really don't know. So in terms of public health concerns, there's lots. Safety concerns, so this was something that came up in our conversation at the beginning. A lack of regulation, we really have no long-term data, and there's a huge range of products. And many studies are potentially biased because they're done by e-cigarette producers, and some of these producers are also the producers of tobacco, like conventional cigarettes. And so if they're saying, oh, these products are healthy, I kind of raise an eyebrow at that, because they know that conventional cigarettes aren't healthy and continue to produce them. So I don't really buy what they have to say. And it makes me think a little bit about kind of old tobacco ads. So this one says, inhale to your heart's content, because these are mild cigarettes. Why physicians call our new brand a health cigar.
Marlboro Man.
Exactly. So like we've kind of been in this situation previously where cigarettes were kind of marketed as some being light or mild, and we know now that that doesn't infer any more safety around these products, and they're all dangerous regardless of whether they say light or mild. There's been some really, this is a bit of an aside, but there's been some really interesting research looking at, from a public health standpoint, what has worked in terms of decreasing cigarette use. And packaging is one of the biggest things. So price of cigarettes, the higher the price, the more likely people are to not start or to quit. If so, the more expensive they are, essentially, the better from a public health standpoint. And then a lot of countries have started moving towards generic packaging. So in Australia, all cigarette packages look exactly the same. So regardless of the brand, they all have like a white top, and then it's like an ugly brown. And all the brand is written in the same font, and you can't use the words light or mild. And in Canada, there's some early discussions that we may move in that direction of generic packaging for cigarettes. And then the health-based warnings on cigarette packages Canada was actually the first country to implement that. And then I found these e-cigarette ads that really market themselves as being really safe products that are healthy. So purity as water, warm as sunshine, electronic cigarette. Like, do we actually know this is the case? Probably not. This one's called Safe Cig. And so someone had asked a question earlier about popcorn lung. Essentially, we don't know if this will be the case. So what popcorn lung is it's a lung disease called bronchiolitis obliterans. And the reason why it's called popcorn lung was there's a microwave popcorn factory in the US that they found that a lot of their employees were developing this disease called bronchiolitis obliterans. And what they determined to be the cause of it was that the flavoring agent used in microwave popcorn, while it's safe for oral consumption, it's not safe for chronic inhalation. And so the flavoring agent is called diacetyl, and diacetyl is in some of the e-cigarette flavoring. So will we see this future generation of people with bronchiolitis obliterans? It's possible. We really don't know yet. I have read recently that diacetyl is also in conventional cigarettes to a bigger degree than in e-cigarettes. So I don't know. Like long-term data right now is looking at people using it for 6 or 12 months. So when we compare that to the data we have for chronic tobacco use, it's not really comparable. So we don't know in terms of long-term health effects what the effect will be of these products yet. In terms of other public health concerns that may prevent or delay cigarette cessation or quit attempts among current smokers, and certainly that's what the literature that I presented earlier seems to support. And I think the advertising has really encouraged this, that like, why would you quit smoking? You could just switch to an e-cigarette and it's totally safe. So that's what this ad to me says. And then renormalization of cigarette smoking. And I think this is a really big concern. Like, so much money and time has gone into educating the population about the risks of cigarette smoking. And I think that this e-cigarette use has the potential to undo some of that. So to be determined.
Talk about a marketing ploy. Hit
Yeah.
the high school kids.
Yeah, you bet. And it's
Always 10 years old plus. It's like, what a great marketing ploy.
And I think that that's really one of my biggest concerns is really the targeting of these products towards youth. So I included some pictures of some of the flavoring agents that I think are really like, this is specifically targeting youth. So lots of them are kind of candy flavored.
Oh, the smell is disgusting.
But for kids, they're like, I love it. I don't like that type of gum now, but when I was a kid, I loved this.
I love that smell, but it's not that smell.
It's not
But
that
to them it is?
Yeah. And there's a lot of the flavors are marketed as like kind of candy, like cotton candy or whatever.
I don't feel the bright colors.
Exactly, yeah. And there's some alcohol flavored ones, but gummy bear. In terms of the research that we do have looking at kind of these products, what it shows is that this was a really neat study. It's really big. And what they do is they surveyed middle school and high school students in 2011, 2012, and 2013. And they looked specifically at people who had never ever smoked traditional cigarettes. So only people who had never smoked were included in this survey. And then they had lots of, they had about 24,000, between 18 to 24,000 surveys per year. And what they showed was between 2011 and 2013, the number of youth who had used an e-cigarette increased threefold in 3 years. And that seems to be pretty consistent with the data I'm seeing, that it doubles every year. And then what they looked at is among the youth who had used an e-cigarette, what was their intention to smoke conventional cigarettes in the next year. And I think, I didn't write it down, but the way that they phrased the question on the questionnaire was something to the effect of, if a friend were to offer you a cigarette, would you accept it? And then they had like, never, maybe, probably, definitely. And if you answered anything except for never, that was assumed to be a positive response, that you would had the intention to smoke. So if you said maybe or probably, that would count as positive. So what they found was that among people who had used an e-cigarette, they were more likely to consider themselves, consider using a conventional cigarette in the future. So that's concerning. Will all this public health work that's been done, because a lot of youth, I think, these days will not smoke traditional cigarettes, and they're like, no, that's bad, it's gross. But will that kind of undo a lot of the work that has been done? To be determined. This has been a huge concern that it will act as a gateway drug. So far, the data hasn't shown that it has actually resulted in an increase in conventional cigarette use. So far. So far, despite the concerns, we haven't seen kind of an uprise of cigarette smoking among youth. It's still really early days in terms of this data collection, so in 5 years from now, I think we'll get a better picture.
What's way more acceptable?
The e-cigarette use.
Well, my son smokes e-cigarettes, and he doesn't smoke any flavor anymore.
Mm-hmm.
So you don't know he's doing it, because
Right.
you can't smell it.
Right.
And I used to be a smoker, so all of my clothes had that smell.
Yeah.
So you don't have that smell, so it's not, people don't look at you with disgust like they have, now for smokers.
Mm-hmm.
So it's way more acceptable.
And that stigma around cigarette smoking isn't necessarily there with e-cigarette smoking. Would you say that's?
I would say it's not there at all.
Yeah, and if anything, it may be looked at, like, especially among youth, like, oh, that's really cool.
Oh, my daughter, they do a thing called hotboxing,
Okay.
and they'll have a party in a house in the wintertime, and everybody will vape until the whole room's full, and my daughter hates vaping.
Right.
She had to leave a party, she said they were hotboxing, Mama couldn't breathe.
Yeah.
It was like,
It's coming. This study I thought was really interesting, and I think that your experience with your own kids, and as a teacher really speaks to kind of how easily accessible e-cigarettes are to youth, despite the fact that technically you're not supposed to be able to purchase them unless you're 18. So this was a study published a couple years ago in JAMA Pediatrics, and they looked at sales of e-cigarettes to minors if you purchase them online. And so they had 11 youth aged 14 to 17 make supervised e-cigarette purchases online from 98 different e-cigarette vendors. And so they had a credit card from the study office, and what they found, so it was illegal in North Carolina where the study took place, and what they found was only 5 of the 98 attempts to purchase a product were rejected because of age, and then there were no attempts to verify age at delivery, and most of the orders were just left at the door. And the study, their kind of overall conclusions were that it's really easy for teens to buy e-cigarettes online. So it's like if you have access to a credit card, it's really easy. Sounds like even if you don't have access, you could probably buy it from someone's locker.
You pick up Go Safeway and buy a free, one of the Visa cards, that's how my son did it.
Prepaid card.
Okay, a
Yeah,
prepaid
you put
card.
cash down on it, you get it. You
Yeah.
call up, you buy it. That's
Yeah,
how
so
he
it's
did
pretty
it.
pretty
I mean,
easy.
I was horribly controlling, went down to the vape shop and sat outside and watched my son go in and went in and threatened him with that and realized that wasn't good.
And do you know at the vape stores in town, do they make an effort to try and
Not at
check
all.
ID? So if you were
Scared the hell out of
16,
the kid selling that day, but
Okay.
I got conflicts and he quit working there. But yeah,
but if
no,
you were
yeah.
16, they would sell it to you,
I
or
called the police. I'm sitting out front here, this guy just sold it to my 12-year-old,
yeah.
you know, and I just watched him do it. They came down and told the guy, don't do that.
Okay. Whereas with conventional cigarettes, I think the people selling it take it quite a bit more seriously in terms of checking ID, is my assumption,
Well, they
having
get
not
in
worked.
trouble.
Exactly.
So I'm not sure how long ago that was, but I had an experience last year where I went in with somebody who wanted to purchase e-cig here in Castlegar, e-cig liquid or something. They wouldn't let the youth in the door
Okay.
because he didn't have his ID with him.
Okay.
Wow.
Okay.
So,
So
That
variable.
was a while ago.
yeah, so that was just last year. So I
Okay.
think the shop owner had quoted a new regulation that had come into effect, and so therefore it was essential for him to let anyone 19 or under 19 in the shop,
Okay.
and yeah.
Oh, cool.
Okay. So maybe it's changing, or it may be variable shop per shop. Yeah, no, and it doesn't change this at all. That I think I mean, in the same way that there's lots of youth that smoke cigarettes, and if you want to purchase it, you find a way to do it. Same with alcohol, same with anything else. But it's easily accessible online. In terms of limitations, there's so many limitations in the research that we have. There's this huge range of products. So it makes it really difficult to generalize the results. A lot of the earlier studies that we have are looking at those first generation products, and it's really tough to know whether those are even comparable to the newer products. And I don't see many people using the first generation products at all anymore. It's all the like tank style big e-cigarettes. There's no standard methodology in these studies, so that's, I think, a big gap in the literature, and no regulation of the products, no long-term studies. Long-term is like 6 months, so it will take us probably several years at least to get a better understanding of what's going on. And then conflicts of interest with e-cigarette producers funding a lot of the research. In terms of just like a quick summary, yeah, so e-cigarettes for smoking cessation, as currently being used, e-cigarettes are associated with significantly less quitting, not helping people quit, and should not be recommended as a first-line smoking cessation tool. As a harm reduction tool, it seems as though they're less harmful than conventional cigarettes, and it may be useful to have people switch totally over to e-cigarettes if they're kind of those dual users. But really, we should be talking to people about setting a quit date even from the e-cigarette. And then lots of public health concerns. There's probably many more here that will come up. So no long-term data, big concerns around use among youth and lack of regulation. And then I really liked this conclusion. So at present, it's impossible to reach a consensus on safety of e-cigarettes, except perhaps to say that they may be safer than conventional cigarettes, but are also likely to pose risks to health that are not present when neither product is used. And then this is just from the Canadian Cancer Society. What they've said is that really we should be using nicotine replacement or other first-line products, so varenicline or Champex or Zyban, or the generic name is bupropion. So that's kind of the approach that Canada has said, and we shouldn't be using e-cigarettes, or we shouldn't be telling individuals to use e-cigarette as a smoking cessation device. The American Heart Association has said that they shouldn't be recommended as smoking cessation tools. If they are using e-cigarettes, they should be advised to consider a quit date. And then if initial treatment fails or a patient refuses conventional treatments and wishes to use an e-cigarette, it's reasonable to support that attempt. And I think that's reasonable. If they really want to give it a go with an e-cigarette, I think it's worthwhile in supporting the effort because it's likely a safer option, but then with a plan to not use it indefinitely. And I think that's what gets tricky, is that people switch over, or they may smoke still a couple of cigarettes per day, and then they're like, well, why would I quit? Because now I'm on this e-cigarette and it's totally safe. So education around that piece is important. And that's all I have.